Hello and welcome to Motion, Palpation, and Joint Mobilization of the Neck. This DVD covers two topics: motion palpation assessment and joint mobilization treatment of the neck. Special orthopedic assessment tests of the neck are also presented. Motion palpation is an assessment technique that assesses joint range of motion one joint at a time. This is important because gross range of motion assessment of the cervical spine cannot discern specific joint dysfunctions, that is, joints that are hypomobile, having decreased range of motion, or joints that are hypermobile, having increased range of motion. Joint mobilization is a treatment technique that is essentially a specific method of stretching that is directed toward deeper intrinsic tissues at a specific segmental joint level. These deeper tissues are ligaments, joint capsules, and deeper intrinsic muscles such as the rotatories and multifidus. Joint mobilization is important because it is the only stretching technique that can address specific joint dysfunction hypomobilities. If a stretch is applied across the entire cervical spine, a hypomobility may not be stretched because of adjacent hypermobilities that compensate and move more. Some specific orthopedic assessment tests are also presented because they assess for pathologic conditions of the joints, including those conditions that would contraindicate joint mobilization as well as general stretching techniques of the spine. Motion palpation and joint mobilization are very precise and effective techniques. This DVD gives an excellent basis for learning them. However, because they are so precise, if you ever have the opportunity to attend an in-person workshop on these techniques, it is strongly recommended.